Hi there.
Hello.
Drew Robertson.
I'm Kim.
Resident family medicine. We're going to do a hip exam.
Okay.
So I'll get you to stand up and go in the hallway and we'll observe your gait to start. So just go up and down the hallway. So really I'm observing from the back down to see if there's any scoliosis or excessive lordosis in the lumbar spine, which there isn't. And then in the hips themselves, if there's any signs of any Trendelenburg gait, so if the opposite side there's any dipping down to suggest a weakness in the other side's abductors, which I don't see. Looking down for the nice normal valgus position into the knees and then down in the legs into the feet. And then just looking at the actual phases of her gait, so normal heel strike and transition to the toe off, nice and symmetrical, normal pace, there's no foot drop. We'll get you to stop there, and you can actually keep facing. So if we're testing for the right side, we'll get you to lift your left leg up. So looking for any hip drop on that side, so it's a negative Trendelenburg sign. We'll get you to come back in the room. So the first thing with observing is if there's any obvious deformities here now that she's not weight bearing. So if there's any obvious leg length deformity just looking, or if there's an external or internal rotation or any other deformity there, which there isn't, I'll then start localizing it just in terms of proper draping. If we just see the top of your iliac crest, and for the purpose of this video we won't go directly to the pubic symphysis, but we'd look there, any swelling or erythema down the inguinal ligament to the acis and superior iliac crest. No signs of any swelling, any erythema or wounds. I'll get you to go on your side facing the wall. And then continue appreciating along that iliac crest to the posterior superior iliac spine and the ischial tuberosity to see if there's any visible swelling there. I'll get you to go back on your back now. So the next part is palpation. So basically following the systematic way, I'd start with if there's any tenderness in the pubis symphysis, down the inguinal ligament to the acis, up the iliac crest, into the, and I'll get you to go on your side again. So that anterior superior iliac spine, there's no tenderness. Following the crest to the posterior superior iliac spine, the ischial tuberosity. In this position now too, if there's any signs of any trochanteric bursitis, which there isn't. I'll get you to lie back down on your back. So now we'll go through range of motion testing. So for active range of motion, I'll get you to bring your knee up to your chest as far as you can. So nice normal hip flexion there and bring it back down. And if you can cross over your leg, cross your other leg. So a good 15 degrees of adduction, and then for abduction, bring your leg out towards me. And I'm going to get you to go back on your side again. We can test for that abduction again in this position if you lift your leg up. Good, 45 degrees. And then bring your leg towards me, and I'll just stabilize the hip here. So good hip extension. And now I could repeat all of these with passive range of motion. So with that hip extension, with the abduction, and I'll get you to go back on your back. The hip flexion, and in this position the external rotation, so a good 45 degrees, the internal rotation about 30 degrees, and stabilizing the hip, the adduction again, and the abduction, which we already tested in the other position. You can now do strength testing, so I'll get you to bring your knee back up to your chest again. So keep it there, don't let me press down. So testing hip flexion strength, and we'd compare to the other side to see if it's good 5 out of 5 power. Bring your leg down and bring it back across again and keep it there, okay? Don't let me pull back. 5 out of 5. And I'll get you to go on your side again facing that way. So bring your leg up in the air to abduction and keep it up, okay? Don't let me push down. So 5 out of 5 power and back towards me, and then testing that power in the hip extensions, normal. Now we'll get you to lie back down flat. And now we move on to some of the special tests for the hip. So first we'll check for the leg length. So first the true leg length, so from the anterior superior iliac spine, medial malleoli, and then compare both sides, and they're equal. And then the apparent leg length, so from the umbilicus. So if there's any change here, it would suggest more of a contracture. Comparing both sides, and they're equal. The next test for contractions would be the Thomas test. I'm going to put my hand underneath the small of your back to remove that lordosis, and I'll get you to bring your unaffected knee up, so your left, and I'm looking to see if the other leg lifts off for a positive test, which I don't, which would be an evidence of contracture there. Next, we'll do the Faber test. So if you can bring I'm going to help you out here. We're going to put your hip into some flexion, external rotation, and abduction, and have it resting there. And then I'm going to press down. If there's any pain elicited this, it could be from the sacroiliac or signs of arthritis. So it's a negative test. The next is the fatter test. So flexion and some adduction and internal rotation. I'm providing that stress there. This is to see if there's any groin pain. And do you have any pain there?
No.
So that could suggest if there's any pain from, say, a labral tear. The next test we'll do is if you go back on your side again to the wall and maybe shift a bit towards the edge. So next, what we're going to do is I'm just going to support your hip here with my one hand, bring you into some abduction and extension. And to test for the iliotibial band syndrome, what I'm going to do now is bring you into adduction. And if there's any tightness or pain there, so if it was limited, that would be a positive test, which it's negative. I'm going to start with observation and palpation at the same time just to be organized. So starting with you supine, just observing and palpating if there's any swelling or erythema or tenderness from the pubic symphysis to the acis up the superior iliac crest. I'm going to get observing if there's any swelling, erythema, or any atrophy, deformity. Get you up on your side facing that right now, if you're okay to do that.
Mm-hmm.
So we'll continue along looking for any swelling, erythema, atrophy, along the posterior part, and we're going to palpate down that iliac crest to the PSIS, and then down through the sacrum if there's any tenderness, and the ischial tuberosity, then into the greater trochanter. See if there's any tenderness and any signs of bursitis. So while we have you in this position, what we'll do is we'll test some of your range of motion. So we'll get you to lift your leg up in the air for abduction, so good to the abduction, and then bring it back towards me. So for that hip extension, now we'll just check that with passive range of motion, normal hip extension, normal abduction. We have you in a good position here to do the special test, the Overs test. So just stabilizing your gluteus here, and we have you in slight abduction and bringing to some extension of the hip, and then I'm going to bring you down to see if there's any stiffness there, any iliotibial band pain, which there isn't. When we have you in this position, we'll just finish with the power testing. So we'll get you to bring your leg back up. So test the strength of the abduction. Keep your leg up. Don't let me push down. Good. And now bring your leg back down and towards me, so that hip extension strength. Keep it there. Good. So now we'll get you back on your back and we'll finish the exam from there. So if you bring your knee up to your chest, check your hip flexion, and then back down across your leg for the adduction. Good. Now we'll finish off with checking with passive range of motion with flexion, and then external rotation, internal rotation, back down with the adduction. Now in this position you can keep your leg there and you can test your adduction power. Good, 5 out of 5, and I'd be comparing both sides here. Bring your knee back up, so testing the strength of your hip flexors. Good. And now what we're going to do is finish off with the rest of the special tests. So first checking for any leg length deformities, so from your anterior superior iliac spine to medial malleoli. So checking for that, the actual length of your legs to see if there's any disparity there, which there isn't, and then the apparent leg length. So from the umbilicus down, both sides, which is equal. Next, what we'll test for is the Thomas test to see if there's any contractures. Just stabilize the lordosis of your back, and then the unaffected side, so let's say your left knee, if you bring it up into hip flexion, so I'm looking for this to see if this leg rises, which it doesn't, so there's no signs of any contracture there. And then the last few tests we'll do is the Faber test. I'm going to put you into some flexion of your hip and external rotation and abduction, and then provide some strain there to see if there's any pain, and that would be a positive test for any sacroiliac joint pain or arthritic pain, which there isn't. And then lastly, the fatter test, so some flexion, adduction, internal rotation, and then what I'm checking for there is if there's any groin pain, which could be a sign of a labral tear, and that's the hip exam.